Hello, folks. Welcome back to Unmuted Love. I'm C. Eshelman, Attachment and Trauma Specialist, parent coach, and your host on the path of parenting kids from difficult beginnings right along with you. Today, I want to talk about, of all things, your senses. You've heard of the famous five, I know: sight, hearing, touch, taste, smell. And you may even know the sixth and the seventh sense. The sixth sense is called proprioception. It's your body's GPS system, really. And the seventh sense is called your vestibular sense, and it really helps you understand balance in your body. But if you haven't heard of the eighth sense, I'm going to introduce you to it right now. Can you believe that there are 8 senses when most of us were mostly taught there were only 5? I was certainly surprised when I found out about the sixth, not from the movie, of course, because that's not the sixth I'm talking about, but I was surprised. And also I was surprised about the seventh. And then I learned much later, actually, about the eighth. And then I started realizing, wow, okay, a lot of our kids are dealing with the absence or the miswiring or the unwiring or the lack of wiring of this eighth sense, which is called interoception. And it just might explain half the confusing behaviors that happen with your child in your home. Interoception is how the brain notices what's going on inside the body. Feelings of hunger, thirst, bathroom needs, pain, tiredness, stress, calm. It's like the dashboard of your car: gas light, oil light, check engine light. When those warning lights are broken, you only know something's wrong when smoke pours out of the hood of your car, or it just breaks right down on the side of the road. Otherwise, you wouldn't know. Those lights are super important because then you have a chance to check in and get it fixed before it breaks down. That's what life is like for many kids with trauma histories or ADHD and autism, which are neurodiversities too. Their dashboard lights are unreliable. And what shows up on the outside? Behavior, right? It's just behavior because that's all they've got. They don't have words for it, and their parents don't have words for it. What do they have? They're going to show you what they're experiencing in behavior that's not going to have anything to do with what they feel in terms of like connectedness. Like, I might hit you when I feel hungry. I might cry when I have to go to the bathroom. I might tell you I'm going to throw up when really I need to poop. Yep, that's the truth. So today I'm going to give you 115 everyday examples of interoception struggles. Oh, I'm not either. I'm going to give you a lot of examples for you to think about, not 115. I'm just joking. I'm going to group them so you can check them off in your head. If you hear your child in even half of these, I'll tell you exactly who can help. Spoiler alert, it's not going to be more consequences. Nope, consequences will not change the behaviors that come from the inability to read interoception correctly. Who is it? Who's going to do it? Well, it's going to be your occupational therapist, your OT. And if you don't have one, I promise you, it'll be one of the things that saves you when your child starts to learn about all their internal experiences that maybe they've never really understood before. Let's start in the kitchen, shall we? Your child eats and eats, never sensing fullness until they're sick. Your child refuses food until they suddenly morph into the hangry Godzilla, or they swear they're not hungry at dinner and then raid the pantry 10 minutes later. What's going on? Forget about thirst cues. The water bottles come home untouched, unopened, because they never really noticed thirst in the first place. Or on the flip side, they guzzle gallons and are in the bathroom like all day long because they didn't stop. They didn't have a natural stop. They eat so fast and so messy, it looks like survival mode, not mealtime. They crave odd food combos or medicine foods like extra salty chips or spicy ramen. They'll forget to eat all day because Legos or TikTok stole their attention. Or they confuse boredom with hunger, grabbing snacks because something feels off, but they don't know what. They disapprove of a movie or meal, but can't say why. It just feels wrong, feels like they don't like it. They need lotion compulsively after washing their hands, or food textures are deal breakers for them. I know my husband will not eat a banana. If his life depended on it, he would not eat a banana. And it's not because of the flavor, it's because of the texture. And then, of course, there are toileting issues, right? Sorry about this if it's offensive. I don't want it to be, but it's in everybody's household, so we have to talk about it sometime. If you've ever wondered why toileting is such a battlefield, here's why. Perhaps your child doesn't notice they need to go until it's an emergency level. They wet or soil and act genuinely surprised that it happened at all, or they lie about it. They hold it through play until the last possible second. They bolt to the bathroom during important moments like bedtime, car rides, school drop-off, just very inconvenient times. Independence with toileting lags way behind age expectations. My youngest child didn't potty train until after 4 years old. Let me tell you, those were big poops, not particularly appetizing, let me just say. I didn't know anything about interoception back when my kids were little like that, or I might have actually been able to help with this potty training thing if I understood that he just couldn't feel when he had to go to the bathroom at all. So here's another area that you might see interoception as a thing, right? Pain and illness. Pain awareness is a wild ride with interoception challenges. Some kids don't notice pain until it's extreme. A broken bone? Oh, they might say, I'm fine. But then they nick themselves a little bit and they start screaming. Others react like a mosquito bite is a knife wound. Doctors might comment on unusually high or unusually low pain sensitivity. They can't explain or rate pain at all on one of those scales when they go into the doctor. I just feel bad, they say. They don't connect headaches to tight ponytails or stomach aches to anxiety. They throw up before realizing they're sick. My oldest child used to do that. She would just literally be standing there getting ready to go to school and projectile vomit straight at me, having no idea that she felt sick in the first place. Then you might have a child who delays medical care. They don't tell you they're sick and they don't want to go get help until an infection is dangerous because they didn't feel bad enough. My older children, once they became adults, actually had this kind of problem. Or they pick at skin until there's a hole without noticing the damage. They forget to shower and don't notice their oily hair or body odor is out of this world. They miss the signs of allergic reactions until someone else points it out. Is any of this sounding familiar to you? If it's sounding familiar to you right now, wait till you hear the rest. So if your child seems weather confused, this will sound familiar to you. They insist they're fine outside in 15 degrees and they don't want a coat and they want to wear shorts every single day, no matter how cold it is. Or they strip layers, insisting they're hot in a perfectly normal room. They overdress, underdress, or wear thermal boots in June. Tags feel like torture devices. Only one brand or fabric is tolerated, all cotton or bust, right? They melt down about socks. They either have to have them on or they never want them on. Or you have to turn them inside out so the seam doesn't bother them. Tiny shifts in room temperature distract them completely. And then there's sleep. Oh, sleep, the holy grail, right? Interoception can make it messy sleep. They look exhausted, but swear they're not tired. Bedtime is a war zone. Then they crash instantly right after their head hits the pillow. They sleep like the dead. Missing alarms and commotion. They can have alarm after alarm after alarm because they swear they want to wake up on their own by their own alarm and they just can't do it. Or they wake constantly but can't explain why. They can only sleep with specific textures or only with a fan, even in winter. They fall asleep on uncomfortable floors or in unsafe spaces like the bathtub, the car, right on the playground, on the merry-go-round. They push through fatigue until total collapse. They don't notice when medication kicks in or how medication feels when they take it. And then there's emotional awareness. Emotions live in the body. And if the signals are scrambled, look out. They explode seemingly out of nowhere. I don't know why. Tears surprise them. I didn't know why I was crying, they'll say. They confuse sadness with stomach pain or nerves with hunger. They can't tell butterflies in the belly from panic. They panic when routines change, but can't say why. They're socially uncomfortable, but only realize hours later that they were having a hard time. They're overwhelmed being the center of attention, but don't know how to be helped. And sometimes they make themselves the center of attention when they really don't want it. And then how about those sensory quirks, right? This is where interoception and sensory processing just do a little dance together. They chew their sleeves, their pencils, or their hair. They have unconscious self-regulation that way. They complain of weird body feelings with no details. They're hyper aware of tiny changes. A haircut really drives them crazy. Nail polish, trimmed bangs, things like that they think they want, but then they peel them off right away, or they can't stand them, and so they cut them all the way down to nothing. They hear faint noises, heartbeats, their own breathing, and they can't tune them out, and it makes them feel like they're going crazy because they can't stop thinking about it. They feel socially different but can't express how or why. They hold their muscles taut constantly, not realizing that this is not normal and that it's very tense for them. They haven't figured that out because they can't experience it in the same way. They can't understand what it is they are experiencing. And then medical safety. Oh boy, medical safety. Sometimes it's so scary. They don't notice dehydration headaches until they're so severe that they're about to pass out. They run stress-induced fevers. It's psychogenic fevers, that's what it's called. They faint. They panic or collapse without warning. They forget to eat, drink, or rest until their body literally forces shutdown. Okay, so that was a lot. I probably should have counted them. They probably are 115 now that I think about it. I was just joking when I started, and now I realize, wow, that actually might have been 115 ways your child can be impacted by the backfiring of the interoception sense. So why does it all happen? For kids from difficult beginnings, body cues and caregiver responses didn't line up in early life. Crying didn't reliably bring food, comfort, or a diaper change. Their brain learned no point noticing this because nothing's going to change by focusing on it. For kids with ADHD or autism, sensory wiring differences mean cues get misread, overnoticed, or undernoticed. What's the bottom line? Well, these kids aren't dramatic drama queens. They're also not lazy or manipulative. Their eighth sense, the interoception dashboard, is unreliable for them. Behavior is their smoke alarm. So what can you do to help? Well, here's the part where I can save your sanity right now. You cannot consequence a child into feeling hunger earlier. That makes sense, right? But you also cannot sticker chart them into noticing bladder signals. You cannot ground them into better sleep awareness. This is wiring. It's not willpower. And the superheroes for rewiring are occupational therapists. Yay! I loved all the occupational therapists in my child's life because they really helped my children understand their own bodies. And that was so important to me. And they also, of course, helped me understand their bodies too. OTs help kids notice what's happening inside, label it in safe, kid-friendly ways, learn strategies to respond before it's meltdown o'clock time. They use sensory play, movement, body scans, and mindful practice. Over time, kids learn, hey, my chest is tight. I think that means I'm anxious. Or my stomach growled. I think I need some food. Or my body feels buzzy. I need to bounce, not hit. OTs are optional. They're optional, but I'll tell you, they will save your life. They are the bridge between your child's body signals and their ability to regulate. Please don't pass this up. Get a good evaluation from an OT. You won't get the best evaluation for interoception in a school system. So go outside the school system and get an evaluation out, because that's where you're going to get the most information and actually the most help. So dear friends, if your child feels like a daily puzzle with no real good picture of what it's supposed to be on the box, I want you to hear this. You're not crazy. Your child's not crazy either. And there is help. Seek out a trauma-informed pediatric OT. It's so great to find somebody who actually really does both things, mind, body, and emotion regulation OT. Here's the truth. Body senses really matter. Hey, your love matters too. But love plus the right tools, that's rocket fuel, baby. Yeah. If you have the right tools, healing is ahead. Okay, folks, that's enough about the senses. And I didn't make too many bad jokes about the sixth sense. And, that's because my husband told me I should keep my day job because my jokes aren't that funny. So this has been Unmuted Love with me, C. Eshelman. And if today's episode opened your eyes, share it with another parent who's trying to figure this all out too. Until next time, stay courageous, stay strong, be gentle, and don't forget, your love matters when more than love is required. See you in the next episode.